and start and people can join in already. Good morning, everyone, and welcome to today's webinar, Next Steps for Transparency in Pharmaceutical Supply Chains, Overcoming Challenges and Exploring Opportunities. We're glad you could join us today for this very important conversation. And we are bringing together healthcare professionals, policy experts, industry leaders, academics, sustainability advocates to explore how we can advance transparency across pharmaceutical supply chains. At Healthcare Without Harm Europe, our mission is to transform the healthcare sector so it reduces its environmental footprint, becomes more resilient, and leads the way in sustainable development. We believe that protecting health must go hand in hand with protecting our environment. In the light of this, I would also like to shed light on a conference that we have upcoming, Clean Med Europe, which is an online conference taking place from June 10 to 13. As Europe's leading event on sustainable healthcare, it will bring together healthcare leaders and sustainability advocates to share innovations and solutions for transitioning to more sustainable healthcare systems. It will feature over 70 speakers and 35 sessions, workshops, so you will have accessibility to them live and on demand after 4 weeks. For this webinar and our previous workshop, A Greener Pharmaceutical Supply Chain for the People and the Planet, we brought together diverse stakeholders to highlight the urgent need for standardized public environmental reporting in the pharmaceutical sector. We identified some persistent gaps and emerging tools that can support greater traceability, and transparency was one of the main challenges that was highlighted during the webinar. So today we're here to kind of build on these insights, and we'll start by exploring transparency and environmental challenges in pharmaceutical supply chains, along with the current policy landscape. From there, we're going to turn into some practical tools like standards and sustainable procurement, and conclude with recommendations for advancing accountability and environmental action. There's going to be a Q&A towards the end, so please leave your questions in this chat, or you can have them on a piece of paper next to you and come back to them towards the end. We encourage you to ask questions and to engage in conversations towards the end. Pharmaceutical supply chains, as we know, are long, global, and complex. They often involve multiple suppliers, subcontractors, and manufacturing sites spread across different countries. This fragmentation makes it difficult to trace where our medicines are coming from, how they are produced, and whether ethical and environmental standards are being upheld. So here, transparency is not just about access to information, it's about accountability as well. It's about ensuring for protection of human health that we aren't harming the planet at the same time. That requires visibility into every step of the supply chain. With that, let's begin. We have the first block of discussion, Where Are We Now? Transparency in Pharma Supply Chains. And our first panel features Andrea Caputo-Svensson, Global Health Advisor at REACT. His work focuses on REACT policy and advocacy, particularly concerning research and development and sustainable access to effective antibiotics, the intersection of antibiotic resistance and cancer treatment, and One Health. Joining Andrea is Katerina Petrovoka-Mitkidis, an associate professor at Aarhus School of Business and Social Sciences at Aarhus University, and her research expertise lies in the areas of sustainability and law and corporate social responsibility and pharmaceutical legislation. So let's start off with taking stock of the current landscape. Where do we stand when it comes to transparency and what needs to be changed? I'm going to ask a question to you first, Andrea, but feel free, as it's a discussion format. Katerina can pitch in whenever she wants. What do you see as the most pressing environmental hotspots in pharmaceutical supply chains today? Where is transparency most lacking, and what kinds of data are needed to better monitor and address these issues? The floor is yours.
Thanks, Ilona, for inviting me and inviting REACT to speak in this important webinar and discussion. I think it's really important and also very timing to discuss this today. And thanks also for the introduction. I'll also try to bring, as you mentioned, I'm part of REACT. It's a global network sitting on 4 different countries and continents at the same time. I'm sitting in Uppsala, Sweden, so representing Europe, but we're also having offices in Ecuador, Africa, and in India. So I will try to bring more of the global perspective as well. Since we know that antibiotic resistance, it's an issue that concerns everyone, everywhere, and we really need to come together to address it. To really answer your question and getting into the more details of it, when we talk about hotspots, the first thing that comes to mind, it's definitely the manufacturing sites. So we have some data that really highlights how in the manufacturing sites where antibiotics are produced, and specifically where API, so the active pharmaceutical ingredients, are produced, we have the the highest concentration of those substances in effluent water. Um, Specifically, if we look into some countries, we know that when it comes to production of APIs, almost two-thirds of the production is coming from both India and in China. So we've been doing some study before and indeed looking into what are actually those concentrations of APIs in the effluent water, but specifically also how are those affecting at the end of the line, both the development of resistance within the bacteria and how then eventually that can reach also human health. And as you were mentioning in your introduction, also affecting human health as well. It's really important to notice that there are several of those manufacturers which indeed are happening in low-middle countries, and reasoning are multiples, going from the fact that we know in certain low-middle-income countries, regulations are not as strict as perhaps in some other high-income countries, for example, including Europe as a region. But also because, of course, costs, sometimes costs manufacturing is indeed lower in low-middle-income countries than it's in high-income countries. On the other hand, sometimes there are regulations present in also low-middle-income countries, which specifically look into the environmental residues. But at the same time, those rules or regulations, they're not enforced. And that, of course, it's a bigger issue. We saw, for example, to give perhaps a bit more of a background and examples, in 2019 and 2020, India has shifted towards a more environmentally sustainable rules, looking into the effluents and some specific values, as we know, like this PNEX, so no effect concentrations. But of course, also those regulations are sometimes connected to that specific government ministry present that time. And we know that sometimes the mandate is of few years, 4 years, for example. And then when that changes, then those regulations perhaps are not continued because maybe it's not a priority in the agenda. So it's really important to also look into that to understand how things are changing also over time. Definitely another issue that I see it comes into like infrastructures and the presence of this technology or not presence of this technology in manufacturing facilities. And that somewhat hints at the technology transfer. We know that possibilities when it comes to also resources and money are more present in high-income countries, and there are already some industries that have developed some technologies which would allow what is called like a zero sort of like effluents when it comes to APIs in the water. But sometimes those technology, or most of the time I should say, they're not transferred into low-middle countries for the reasoning I just explained. And that's still an issue given the fact that indeed antibiotic resistance knows no borders, right? Another issue that we do see, it's definitely the opacity of the supply chain when it comes to really finding those specific data and really looking into but what are the actual numbers and how can we work towards better monitoring and evaluation of those levels of APIs into the water. And that unfortunately has not been disclosed for in many cases, I should say. Which makes it extremely difficult also from a public perspective and from a civil society perspective to really push for that type of accountability. And I think that's definitely a right for the consumers of antibiotic, which are indeed like all citizens, including all of ourselves at some point in our lives, to really know how that specific antibiotic has been produced and what are the consequences, and making also specific and informed choice if there is the possibility to choose something that has been, for example, produced in a more environmental friendly way. Some ways also to look into that, it's definitely looking into the incentives. What are the incentives out there that would allow, for example, manufacturers to move into a more environmental friendly production? At the same time, we need to keep into mind that definitely both affordability and access. So as representing civil society and the public, we definitely don't want that the consequence of that is an increased price of medicine, which wouldn't allow already people having difficulty having access or afford this type of medicines, specifically here talking about antibiotics, not having even that opportunity anymore. So that's definitely, it's not a solution for us, the way we say it. I was hinting before also at surveillance and monitoring. We know there are some systems already also out there looking into that. For example, the GLASS from WHO, I think most people perhaps also in this call are familiar with that. But definitely that also becomes difficult when those data are not available or there is not a possibility to monitor those effluent water. So then we are back to a situation of unknowing, and that's not where we want to be, right? Also looking into more of an aspect from a more global governance perspective and how that is really affecting everyone and should be looked into an issue, not just concerning the environment, which is definitely important, but how is that concerning also human health and One Health, if we want to talk about the broader perspective. And that's where I think also government should be accountable for that. One way, now that national action plans for AMR are being renewed in many countries, also the global action plan, it's in the process of getting renewed. I think there is an opportunity there to really have some clear messages and requests and demands when it comes to environmental sustainability for, of course, production of antibiotics, and really looking into system to make sure that there is that type of earmarked funding support, because we notice for different fields when it comes to antibiotic resistance, of course, that when there are no specific funds for it, then it's a nice written paper, but then the implementation of it doesn't happen if there are no funds for it. Something else that perhaps I think it would be important also here to mention is definitely the fact that we've been looking, of course, into the more private sector and industry and how they can make sure to move towards a more environmental friendly production. But also we need to take into account that public and for-profit production is also an important option here. So expanding into that and looking into what are the essential antibiotics and ensure the availability, affordability, and environmental compliance, it's definitely something that should be explored more and perhaps, or I don't think has been done enough as of now. Last but not least, I think we're going to discuss perhaps that later, seeing the other speakers as well. It's looking into more the pool procurement practices and really making sure that when we discuss pool procurements, that environmental standards are one of the demands, the key demands that are part of that. So I'll stop here for now if I answered your question, but I'm happy also to take more questions or expand on some of those points, just hinting at that. There are broader discussion for sure than this. Thanks.
Thank you so much, Andrea. I think you gave a very nice overview of what are the challenges that are faced, and you kind of give the systems perspective going from NGOs to industry to the government responsibility. And as you said, it's a responsibility really of everyone. I would like to go back to some of the points you mentioned, something about regulation. Maybe Caterina can come in here. And I wanted to ask you, Caterina, speaking of regulation and voluntary codes, to what extent can voluntary codes like codes of conduct, ESG pledges, drive meaningful change in the pharmaceutical sector? And are we risking to face more challenges by continuing on self-regulation, so more voluntary instead of obligatory? Yeah, if you can jump in.
Absolutely, absolutely. Well, thanks, Andrea, for a wonderful introduction to the topic. You mentioned basically all the problems we are facing, and now we should expand and offer some solutions. And thanks, Luna, for inviting me to speak today, to give my opinion here. You asked about basically pledges of companies, of industry, and self-regulation, and how meaningful change can it bring really in pharmaceutical supply chains. Well, to my understanding, it can bring less change than in other close to consumer industries. Close to consumer industries meaning industries that sell products that consumers use directly. Consumers use pharmaceuticals, of course, but often it is not the decision of the consumer which pharmaceutical, for example, which antibiotics to buy, right? But they are more interested in getting treated. And that's what the healthcare professionals also interest is. So it is a little bit, we are kind of relying on the fact that pharmaceutical industries will pledge to become more environmentally responsible. And in other industries, it is the consumers who drive the change. They kind of build up a pressure on the industry. But here we are not seeing it in the pharmaceutical industry, so we are missing motivation. That's what Andrea was also saying. Speaking about motivations, it's very important. But in the European Union, now I'm sitting in Denmark, as I'm working mostly with European Union law. So in the European Union, I think kind of give up on relying just on the voluntary pledges, right? We see regulatory developments. We see, for example, the extended producer responsibility in the urban wastewater treatment directive. So producers of pharmaceuticals will be asked to basically pay for wastewater treatment to get rid of pharmaceutical residues in there. Now, how this will be implemented, that's another question. There's actually probably coming a case in the European Court of Justice or Court of Justice of the European Union about that, because pharmaceutical companies ask, why only us and cosmetics? Why not other industries, right? And we have seen already a proposal for the new pharmaceuticals for human use directive that basically strengthens the environmental risk assessment procedures and makes it possible to refuse marketing authorization for new pharmaceuticals or existing pharmaceuticals if they have negative environmental risk assessment. Now, this is tricky because we will still have to balance the therapeutic effect and the effect that the positive effect that any medication has with the environmental one. And how we will balance it, we don't really know. The proposal is not very clear on that. But I would think that both these regulatory developments make one really important or have one really important effect, and is to create motivation for the industry to really engage in what is happening in their supply chains with the green manufacturing and production. So that's, I think, where relying on voluntary pledges doesn't seem to be enough. And yes, so we need, I think, more regulation, but it needs to be well drafted. And the proposal and the new legislation we have seen has some very big issues in there.
I think you touched on a really important point, both of you, which is the creating motivation for the industry. And as I mentioned at the beginning, supply chains of pharmaceuticals are quite long and they're global. So maybe here, Andrea, you work on the more global level. You can maybe perhaps tell us what kind of are the major roadblocks to creating a globally coordinated framework for transparency and pollution reduction in the pharma sector. And are there any practical efforts being taken? What kind of efforts can we take? If you can highlight on that briefly, that would complement the conversation nicely.
Yeah, no, absolutely. And I agree with what Katerina just mentioned. I think it was a very excellent overview of what are the regulation in place in Europe. And as we were saying also right now, the fact that whatever happens in one country also can affect along the supply chain from the beginning and vice versa, right? So it's really important to be looking at the full supply chain and avoiding the fact that, as we were hinting before, a lot of manufacturers that moved part of their production somewhere else is for where regulations are lower. Definitely, like one of the roadblocks, I think, having this fragmented regulation. I agree with the fact that having voluntary pledges is not enough, specifically when it comes to looking globally, right? We can imagine it's already an issue talking about Europe or region. Think about moving that issue globally. It's definitely doesn't work. We need to come together. Countries should come together. And specifically the main actors to really look into, okay, let's make some sort of enforcement which is scientifically based, right? Because we want to have some values when it comes to both PNECs and APIs and, for example, bacteria in the water, which are scientifically sound. And there are several groups already working on it. So I think we should, shout out to them. At the same time, I think what's lacking is indeed this consistency between what's happening in different regions or in different countries, specifically if we compare high-income countries, low-income countries where capacity is less. Another roadblock that I see, I was mentioning that before, it's definitely the lack of technology transfer. I think that's extremely important. We shouldn't forget that. It's the possibility that high-income countries have should be, if again the supply chain, it's a global supply chain, then that should be made available also for low middle-income countries, harmonizing global standards. We saw, if I remember correctly, beginning of last year or mid last year, WHO has published some wastewaters guidelines. I think that was an important effort, and there were many actors involved. And I think that's definitely an excellent starting point, but we do need to move that from having those guidelines to then how we can implement them. How can it be, for example, more implemented and binding as well at national level? There are some other organizations, for example, the Africa CDC, as I mentioned before. We are also working in Africa with our React Africa node. And Africa CDC has done some work when it comes also to this, looking into the production of manufacturing of antibiotics, how to become even more environmental friendly. So this should be a better, definitely, alignment and cross-border accountability. So whatever, let's not forget what's happening in other parts of the supply chain. Monitoring, I think it's another roadblock, really making sure that we have a stronger perhaps monitoring, and stakeholder actions. As you also mentioned, Luna, it's definitely a shared responsibility. So pinning it on one actor, I don't think that will be the solution, to be honest. I think we all have an important role also when it comes to speaking for ourselves, perhaps civil society. Our role is definitely to make sure that those other actors are accountable, making sure that the rights, the human rights and civil rights of citizens are respected, that those regulations, if out there, are indeed enforced. So, and as a citizen, as we were mentioned before, if there is the option of choosing something that is more environmental friendly, you have an option to also do that, right? To ask your doctor, for example, about that. So I think it's very much a shared responsibility. Definitely, the industry has a bigger responsibility because of the role they cover, and so has the governments. But I think we should take into account as a holistic perspective and not just pinning it in one, if that makes sense.
Definitely makes sense. Thank you so much, Andrea. This was a nice overview of some of the major challenges. They are quite difficult, but I want to circle back to one point mentioned by both you and Caterina, which is more about the consumer demanding more sustainability. And I would like to understand, maybe from you, Caterina, what do you think public awareness campaigns and civil society advocacy can do in this space? Can we actually have a role here to shift towards more meaningful change and transparency and ethical pharmaceutical production?
Well, this is very difficult question. Thanks, Luna. I think that public awareness campaigns and raising public awareness is extremely important on this issue. Whenever I presented my research to different audiences of people who do not work in this area, they actually rarely knew how big problem this is. So raising awareness, very important. People should know, right? But even if people know, I'm not sure it will drive meaningful change towards environmental production. So I think that where the awareness of public can really help is waste treatment of medicines that we have at home and we throw them out. People should know what they should do with it, and they don't. Even in Denmark, people don't know that they are supposed to return them to pharmacies. And we actually studied like how to motivate people most. And we figured out that if we kind of frame information to tell the people, okay, there's environmental harm being caused, and it's a negative thing. So we try to see, okay, if we tell people you can do some positive change, they didn't react much. But if we told them you do harm, then they reacted more. So I think that in this way, we can affect like pharmaceuticals in the environment problems through public awareness, but changing environmental production towards more environmental production, I'm not so sure. I'm not so optimistic here that we can do it through public awareness. No, I hope like I speak probably against what would be nice to hear, but I'm just not persuaded this is the way. I think that pressure on industry and governments are more important, or is more important.
Yes, Andrea, I would like to respond.
Yeah, if I can have just 1 minute perhaps to answer. Yeah, I think that's definitely a valid point, and raising awareness, I think, is just one of the things that we could do. I agree, Katerina also, I think, mentioned that raising awareness, making sure that people are aware and that there is some at least basic knowledge. It's definitely the first step, but I agree that it's not enough. I also would say that we have a great examples still working on antibiotic resistance, but more from like a civil society and also engaging communities. An example, last year, we worked in a project called From People to Leaders that was working towards indeed the high level meeting on AMR last year, to making sure some of those demands that the community all over the world had was actually arriving to the political leaders, and that were involved into shaping the political declaration that was coming out of the high level meeting. And I would say that like doing that massive effort involving so many different actors, which also have, as we were saying before, like different motivations, that of course differs quite hugely, right, from one country to another. But through like a consultation process, bringing together different opinions, we managed to get over 800 signatures, which I don't think it's peanuts. And that had a huge effect in the end, and really people felt being part of something. I think having a clear goal, having a clear scope, having a platform also for portraying those voices that usually are not part of the discussion is also extremely important, because as civil society, as I mentioned before, we do have the role or being in sort of like in between the governments and people and communities, but also communities, the ones that are ultimately also are affected. I think they should also have a platform to portray their voices. So I think that is extremely important, together with, of course, advocacy and consumer demands. Of course, as we were saying, like the choices that consumer do can have an effect also upstream. Thank you.
I'm going to wrap up. I think we agree that we do all have a shared responsibility, but maybe this responsibility differs from us to governments to industry. And I agree with your point, Katerina. We should focus on what people can do within their power, also linking back to Andrea's example, engaging community, but also putting some pressure and legally binding regulations on industry. Also, as mentioned before, national action plans on AMR from governments. So it all would link together and trickle down to positive effect. I wish we had more time for this discussion. It's really nice, but I will have to move on to the next discussion block. You will come back at a later point for recommendations, so keep all what you said in mind. Now, thank you again for the first speakers for setting the stage so powerfully. Now we will turn to our second discussion block, where we'll zoom in on the role of environmental data and pharmaceutical supply chains and looking at tools like standards and procurement. We have Courtney Soulsby and Samira Busetta. Thank you both for being here. Courtney Soulsby is the Global Director for Healthcare and Life Sciences Sector Team at the British Standards Institution. She works closely with stakeholders to understand market challenges, anticipate future needs, and develop relevant standards that support sustainable development in the healthcare sector. We're also joined by Samira Busetta, who's the CEO and founder of Altai Consultancy, a pioneering firm in sustainable and innovative public procurement. Her mission is to empower organizations to embrace sustainability and innovation by equipping them with skills, strategies, and solutions to navigate the complexities of modern procurement strategies. And she has a lot of expertise in the health sector, especially. Thank you both for being here. First, I'm going to ask a question to kind of set the stage from the beginning on what are the challenges, and it goes out to both of you. What are the tensions that you are seeing related to security of supply and medicines and environmental requirements in procurement from healthcare systems? So if you can reflect on what kind of challenges you both are facing right now. Courtney, do you want to go first, maybe?
Sure, I'm happy to, and Samira, please jump in. I think there's this, and it was touched on in the previous discussion related to antibiotics and obviously a critical medicine for maintaining supply. I think there's this tension of how do we secure supply in this geopolitical environment with very nationalistic focuses now. I think the COVID vaccine crisis that happened highlighted this need of making sure that each country has a secured domestic supply of critical medicines, and are using different levers to try to do that. So in the US right now, it's very much a top-down stick approach. I think in some of the other European countries and in the UK as well, I think they're looking more at the carrot approach to try to drive bringing back manufacturing into, or nearshoring of medicines and into either their own domestic environments or nearby. And it's interesting because I think there's this perception that actually if you increase the type of requirements you're embedding in procurement, that could risk the security of supply and having manufacturers maintain their focus on your market. But actually there's an interesting view that security of supply can be established if you add additional meet criteria to procurement requirements, including environmental requirements. And actually, there's some examples where it's brought manufacturers, back into the market that had previously exited because of a low cost, low race to the bottom from a pricing perspective. So in the Critical Medicines Act draft now, there's an example from Norway where actually they embedded additional meet criteria, including a 30% weighting of environmental criteria into their tenders for antibiotics, for example, where that actually brought manufacturers of antibiotics back to the market who had previously exited because it was too low of a price for the generic antibiotic procurement. And actually, going real quick back to what Andrea was mentioning earlier in the presentation, one of the key parts of the environmental criteria they have embedded in Norway into their tenders is wastewater discharge and looking at control of manufacturing from a pollution perspective. And the standard that we helped the AMR Industry Alliance author, and then the independent certification that BSI has led to actually independently assess that manufacturers are indeed having safe concentrations of discharge into the surrounding aquatic environment, is one of the environmental criteria that's embedded into the Norwegian and wider Nordics country tender requirements. So I do think there's a myth around in trying to increase access or security of supply could be risked if they have environmental criteria in the tenders. But actually, I think this case study and potentially others to come may show that it increases re-entering of the market from some of the leading manufacturers that previously exited because of price.
Thank you so much, Courtney. I think this is a recent discussion that's been going on with the drafting of the Critical Medicines Act. Indeed, the balance between security and environmental standards is, as you debunked the myth right there, people usually argue that with the of standards, there will be exit of manufacturers, but in fact, you mentioned some nice examples of manufacturers being back in the market. Samira, same question goes to you. What do you think are the biggest barriers preventing sustainability goals from being implemented and translated into public procurement practices?
For me, one of the first, let's say, barrier that I've been noticing for a very long time is basically is the behavior of the buyers. It's easy to use the price only criteria because this is what they know how to use, and it's pretty complex to fight it. Recent figures shows that we are still in the pharmaceutical area. Buyers are still using at 90% of the tenders the price only criteria. So it means that the journey is still very long. I would say that, and I think that the example mentioned by Courtney just shows that there is a big lack of knowledge on how to balance the risk on the supply chain and shortages, especially for critical medicines, and the fact that price only criteria will secure that, and it's a big hurdle here, and how to work with the buyers, with public buyers across Europe to raise awareness first on the possibility to use other criteria than price only, and how to use that. And why there are still, let's say, working on price only criteria is the fear of litigation. It's still risky for a lot of public buyers across Europe to use other criteria than price only, because they do not masterize the other criteria. Which criteria I'm going to use, and how I'm going to measure that, and how I'm going to evaluate that.
I'm sorry, I think Samira got muted.
Yes, no, I'm back. So it's a huge problem, and also within healthcare organizations, all I would say right people who are working on procurement project are not always aware of how to go on being more sustainable, or at least environmental friendly when we procure medicines, which lead to the fact that they do not engage maybe with alternative suppliers to open also their tender to other suppliers. So it's a change of mindset, and how really to support the buyers in this complex journey is a key problem. So for me, at least, I would say that support the change of behaviors of procurers is key. If we do not attack this first, then the next steps won't happen.
Thank you so much, Samira. I think this is a very important point, to start from changing the behavior from the get-go and that point of the supply chain. Speaking of environmental criteria, we know that there's still some fragmentation in sustainability metrics across Europe, let alone the global ones, but only also across Europe. From your perspective, Courtney, I'm wondering what kind of environmental reporting standards do you think are the most relevant and useful right now for pharmaceutical companies? And are you seeing a progress at least towards harmonization, or are we still facing a lot of fragmentation on that front?
Thanks, Luna. I think this is the challenge, because the life sciences sector, pharmaceutical sector, very much operates globally, right? They're a global industry and supply globally to low and middle income countries, to the global north. And I think this is the challenge of how do they actually drive sustainable progress in their efforts, whilst also trying to respond to a fragmentation of sustainability green tender requests that are starting to become more and more common, and again, a fragmented way. I would say generally, Luna, is the answer to your question directly. I think the reason I'm mentioning that it is fragmented is that right now, I think Samira had a really good point. There is this rush from procurement organizations to try to embed some kind of green criteria without really understanding what they're asking and why they're asking, and when they get the information, how they're going to interpret the information, compare the information to actually inform decision-making processes. And I think this is a real challenge. I admire the aspirations and the drive to progress and action that's happening from some of these, national health systems, but I do think sometimes it's not all the way thought through of like how are we going to interpret the results of this information, and how are we going to actually use this information to inform decision-making processes, because right now some of it is very much a qualitative view of information rather than a quantitative. One more additional point I'll make is I also think it's not only a behavior challenge, Samira. I completely agree with what you've just said around behavior, but I also think it's a competency challenge. So, price is what procurement organizations are used to negotiating and used to gathering information on. When receiving this information, for example, again, using the antibiotics and antimicrobial resistance challenge, there's this measurement called predicted no effect concentration that says this is the safe concentration of wastewater discharge from a public health resistance perspective and from an environmental perspective. So there's two PNECs that are measured. Can you imagine as a procurement organization trying to interpret the different PNEC results and data collections that are coming? And I think, if we do not standardize the way that industry is measuring this and then independently verifying the assessment, so that all the procurement organization is receiving is a certificate, for example, that says the manufacturer has been independently assessed or independently verified to conform with this PNEC safe concentration requirement. So that's the work that we've been trying to do, is say, how do we align across the ecosystem on what is the right standard so that we are all pointing to this same industry standard, and then subsequently, how do you then independently assure or assess against that's been conformed to? So for the antibiotic manufacturing standard that was launched in 2022, we now have 60 plus antibiotic products that are independently certified, that have conformed to the standard. And now across, I think it's 7 different geographies, they are now requiring this standard and certification in the procurement requirements for antibiotic tenders. So I think, while the certification was launched in June 23, we've now nearly 2 years in, have made significant progress, I think, on aligning not only what industry is doing to measure, but also with the aspiration of what procurement is doing to require in tenders. And final point, and I'll pass to Samira, is that we're also working on, so wastewater discharge is one environmental topic, carbon, greenhouse gas emissions being another very big focus for the whole ecosystem. So we're also in flight, and the standard is launching for public consultation this month to develop a set of product category rules for medicines to carry out life cycle assessments on a product level, so that you can measure environmental footprint of products against a number of the planetary boundaries, including climate change and carbon. So the standard has been worked and sponsored by the top 10 global manufacturers, NHS England, and also the Department of Health and Social Care in the UK, and has now 9 different geographies of representation from academics, NGOs, healthcare systems, regulators, generics, and also innovative pharma companies to on the steering group to help co-author the draft. And BSI, as a standards business, has been helping facilitate the development of that. So I'm really, I will just say proud, I would say, of the level of cross-ecosystem engagement we've gotten to build consensus so that we are all aligning on the method that manufacturers are using to quantify carbon footprint on products, which is seemingly another area coming through some of the green procurement requirements from France, from NHS England's net zero roadmap and their 2028 milestone. In addition to, I know it's very strongly on the radar of some of the Nordic countries as well. So I think that also is going to be a way to hopefully, we have 300 people across 27 geographies focusing and following the development of this standard. So we're hoping this will help align, again, the manufacturer community to point towards a North Star of one method. So when the data is produced, it's comparable, but also for the procurement organizations to point to a single method when requiring product environmental footprinting.
Thank you, Courtney, for sharing what important work is being done on this. Even though we started off, we know, with a bit of a negative tone, like there's still fragmentation and so on, but it's really nice to see that there is work being done on kind of harmonizing and standardizing between manufacturers. I have a more basic question for you, Samira, to kind of bring it back. So, for example, when procurers want to prioritize environmental sustainability, what do you think are some practical criteria or tools that are available to guide the supplier to selection? Do you think there's some specific frameworks that you find most useful or come to mind? I think it's really important for them to also have this guidance in the complex environment. Thank you.
Yeah, that's true. That for me, the first key step would be to use the market consultation step, which is still under use. Get to know your market, get to know your suppliers, but also get to know the practices developed by other public buyers. And for example, the AMR standard that Courtney just presented is one of I would say, key information that public buyers could use. And usually what happens in, let's say, public organization is that they do not have all the time to do this work. So it's really important that they use this moment to really consult the market, to discuss with the let's say the suppliers, and to discuss with them on this topic of sustainability and what is behind, because this is the first key element, and build on that information really to develop some let's say first requirements or criteria, or at least short questionnaire that you put in your tender documents, and you get data from your suppliers. Maybe just, let's say, first level, what are you doing on environmental, let's say, topic, and how do you work with your supply chain, and just to get the first level of information. And this is really underused so far, or at least they do not do this important work, which for me is really key. And then from that, and you develop maybe some metrics to measure during the execution of the contract, where we are let's say implementing some important requirements on sustainability. But getting the first information is really important. And I would say that some examples. So what Nordic countries are doing on AMR is key to get as important information. But there are also other very interesting practices which are under use. For example, developing code of conduct as a practice. You see, like, okay, I want to work with this type of supplier, so I put in my tender documents some code of conduct where the suppliers I'm working with have to comply with. Or, for example, building some scorecard, let's say sustainable source scorecard, just to also monitor some elements, let's say, of how you're suppliers is also behaving when it comes to sustainability. So there are some very interesting tools that are also maybe not widespread and should be co-developed across Europe. So we harmonize the practice, we harmonize also what we're requiring from the suppliers, also to give a push and to make sure that everybody is aligned. So there are a lot of standardizations to be, I think, done on the medicine side, for sure, but also on the procurement side. Yeah, so this way we can, as a buyer, we can drive also the market in a more sustainable way.
Thank you so much, Samira. I think it's always important to go back a bit to what we already have, to work with that, and to always push for improving these standards, improving sustainability metrics, talking about standardization and so on. But it's really important to know that there are some existing tools that procurers can take. Hopefully that will encourage. I see we have maybe 2-3 minutes left. Out of curiosity, actually, Courtney, I was wondering if you are seeing a growing demand from healthcare market for clear environmental data from pharma companies. Is this what buyers and suppliers are currently asking for? If you can just summarize that very briefly.
Yeah, definitely. The answer directly, Luna, is yes. There is an increasing demand coming from different countries. I think some countries are leading, some countries are following, but I do think it is happening now. The time for harmonization is now, I think, to in order to prevent what could ultimately be the risk, which is everyone ends up becoming this tick box exercise to pass tenders, gather data to pass tenders, rather than using the data to inform hotspots and reduction strategies and actually driving sustainable progress. And while I agree with some of the points that were being made earlier of, you know, mandatory requirements through legislation and regulation, and the balance of that with voluntary incentives through procurement, and that carrot stick, which is the best way of approaching it. But the answer is it is growing now already. So some of the leading countries, I think, that were cited, there was a report that was commissioned through the IFPMA, the International Pharma Trade Body, and that's where FPA and ABPI all kind of report up into. And it mentions kind of some leading procurement agencies, some following procurement agencies, and you know, the Nordic countries were very much in that leading, as well as NHS England, and then I think also some of the following countries and following quick, I would say, to a leading position are France, Spain, Australia. So those were some of the countries that were cited in the report, that, you know, you have some leading procurement organizations that went off the mark quickly, and then some that are following in suit quite quickly as well. So I think that was a question that was just asked. So I think, again, the Nordic countries and NHS England, France, Spain, Australia, from what I understand, Germany's coming up the pipe as well, Netherlands as well is coming to suit. So I think there are a number of countries. I think the challenge that, because I'm privileged to be in a neutral body position, the challenge that I think we all have at our doorstep is, how do we work together to understand what is needed from a standardization or requirements perspective? And I do think that involves procurement and manufacturers to work together to understand what are the right fit requirements, rather than procurement going off on its own accord thinking they know what to ask, or manufacturers going off to set their own standards without involving the wider ecosystem. But I do think this kind of meeting in the middle, driving consensus, can be a way that we start to achieve the objective which everyone has, which is sustainable progress, instead of, again, I'll just come back to the risk of fragmented requirements, even fragmented regulation, I'd say, where we end up just having this drive for manufacturers to report on information, rather than using the information they're gathering and calculating to actually embed in their operations and their supply chain to drive progress. And there is a balance there. I mean, some of the spreadsheets I've seen from manufacturers who are mapping all of these different requirements of legislation, of procurement, in different tabs and matrices to say, well, what do we need to report where and what geography against which medicine? I mean, they got a task on their hands. Nevertheless, driving reduction in their environmental impact.
I completely agree. There's so much different and fragmentation in the standards, so that manufacturers actually might have a hard time reporting on all of this, and it makes comparability even harder. And I think you raised an important question as to what is needed for standardization, and I will keep that maybe to a future conversation, but I think it's very timely and important. Thank you both for being here today. You can stay because I will jump into more like a recommendations block, which will be quite short, but if we can also have Andrea and Katerina back. So now looking more onto the recommendations, and we already had some interesting cross-sector reflections from you. If you could propose one concrete actions that, whether it's on the level of international policymakers, industry, civil society, altogether, that they can take to improve transparency and reduce pharma pollution, what would it be? I'm gonna start with you, Katerina, because I see you in front.
I'm trying to figure out, well, I think that the procurement processes are very important, and we have heard Courtney and Samira speaking about that it's necessary to engage the producers and the buyers. I think that there's also another level of the discussion between the public buyers and the private buyers, kind of in between, because private companies have really longer experience in inserting some environmental clauses, provisions in their contracts. Public buyers came later on this topic. On the other hand, they are much more authoritative and make it binding. So I think that there is this important discussion between public and private sector. It's difficult to achieve, obviously, because the private sector has some confidentiality issues in there, and lack of data, which comes back to Andrea's presentation before, or answers before. Private buyers lack data from about their supply chains. Supply chains are obscure even sometimes, and we cannot just enter suppliers' premises and check and monitor what's going on, right? There are legal barriers for us to do that. So I think that there is also a difference in having requirements in tenders, for example, and then in the contract execution phase, when we need to monitor whether the suppliers actually live up to the requirements. So to my knowledge, public buyers are very good in setting the requirements and less good on monitoring after the contract is concluded. But maybe you can correct me, because I am sitting in the academic organization, so I don't have so big insight from practice. But cooperation on the public procurement, I think it's the way to go.
Very valid, Katerina. Thank you so much. I think I saw Samira smiling. Do you want to go next? I think you have something to
Yeah, actually, it was also my point, and I agree with you, Katerina, that public buyers are good. Let's say they are good in setting requirements and criteria. That's sure, but monitoring the contract and the execution of the contract is still a flaw. And yeah, my point was a little the same, and especially because with the Critical Medicine Act, there is here an opportunity to push public buyers mainly, but also maybe also with the private sector to work together and really to join forces. What I see is they need some support, and we were talking about competence, and this is key. I mean, public buyers know how to do public procurement, but what are the environmental, let's say, requirements we'll put in the tender document, how we will make sure that everything is really executed. This is also another competence that we need to maybe develop in order to support public buyers to be more sustainable in their procurements. So we need competence and need maybe a dedicated forum where they meet. Now it's done, but it's not only through projects. So when the project ends, everything disappears. So how we make it, let's say, sustainable? So what kind of forum we can build with the help of the EU institutions, of course, to create this space where they can discuss and exchange. Because what I see, because I've been working in Switzerland for a very long time, is that buyers are not so keen to always open their practices to other public buyers, and especially when it comes to cross-border exchanges, because first barrier is the language, and it's not like they have to speak in English, which is always a problem, but also because they think that their practices are not good, or they are really, I mean, there is a fear really to be, let's say, more transparent. So how we support them in this and make this type of forum more sustainable. So yeah, this was my point.
Thank you, Samira. That reflected really nicely on what Katerina said, and you added very important points on also some barriers like language and how do we actually coordinate on a more global level. Courtney, do you have any insights here? What are our recommendations? One recommendation you could think of, or any reflections?
Yeah, I think the points that have been made by Katerina and Samira are correct. I think there is a vacuum right now, a gap in a mechanism for healthcare system procurers to collaborate to set the requirements. I think WHO Attach potentially has a call to action in their task force. There was a webinar earlier this week from the Attach on which is the climate change group on climate and resilient supply chains and health systems. And they have a call to action around alignment of national sustainable procurement standards. And I think that is a interesting avenue to explore, and one that we're exploring. So that could be a mechanism to attempt what you have just outlined as the gap of trying to align amongst private and public healthcare system or hospital groups on what they're requiring from a green procurement perspective. I think it's interesting. I think, to me, if you follow the concentration of emissions, it's healthcare systems are saying 60 to 70% of their emissions come from their scope 3 or the goods they procure, the supply chain, which are manufacturers. Manufacturers, when they're doing their quantification of scope 1, 2, and 3 emissions, they say 60-70% of their emissions come from their supply chain, which all concentrates to what Andrea was mentioning earlier of India and China. So I think if we remove all of the noise and really want to make progress in this sector around things like emissions or pollution, is really doubling down on how are we incentivizing technological change, education and capacity building in India and China, where the major, I think 65% of all APIs are produced in those two countries globally. So I guess my recommendation is, how do we as an industry sector start to really double down in India and China? And then secondly, I think we know where hotspots are across the value chain of production of medicines. so can we, instead of asking about data to report on emissions, start actually asking about what they're doing about these hotspots? And I think that will accelerate us to actual reduction rather than accounting. And I think we're really right now stuck in the accounting, gathering of data phase rather than the, improvement, reduction, making progress phase. So if we know the hotspots, and there are many reports about where they are, it's solvents, it's renewable energy, it's, we know where these hotspots are across the value chain. So can we just start to build requirements in that area? That's my challenge to us, I guess.
Thank you, Courtney. I think that's very important, like what is being done actually. And we keep, as you said, being stuck in more like talking about gathering data. And we know already that that's being done and we know where hotspots are. So why isn't there action taking place? Andrea, I left you to last because you brought about earlier a more systems perspective, a global perspective, and I know you work on a more global level. So would you like to wrap it up with a nice recommendation?
Yeah, thanks. It's quite challenging now that most things have been said already, and I must say I agree with most of the points already made. Both the importance of having more standardized benchmarks from the environmental perspective across the board. I think we all agree with that, and the importance really establishing what values we're looking at, whether Courtney was mentioning the PNEX, whether it's the development of the resistant genes or resistant bacteria. I mean, let's agree on what are the parameters, the values that we're going to look at, and let's make that as standardized as possible. I think just having perhaps requirements might not be enough. I think we might need something stricter. We might need regulations, especially bringing up the point that the supply chain is global. So applying a specific requirement might not be the same in different countries, or it might not follow, let's say, the same procedure and same process across different countries. While on one hand, I do agree, we do have for sure enough data to really act. I think we still need to be monitoring the situation to really understand. Hotspots can also vary as we see some industry closing, other opening, and there is also some willingness, of course, to move towards a more environmental friendly and really moving towards also regional production. I think was Courtney mentioning before the COVID situation, how also that in a way, among many bad things, but did spark some regional production. They wanted to, okay, let's make everything in-house. So like more moving from this global supply to like having something produced regionally. So also there to make sure to help those new producers or those SMEs, for example, to really comply to what's already out there, do not reinvent the wheel, but let's stick to what the standards are. I think that's also quite important. Keep monitoring that situation. And perhaps last but not least, again, also representing civil society, I think keep pushing it for transparency. That's the webinar today, right? We want transparency. We want to make sure we know what's going in the waters. And as we know, the situation is not the same. I live in Sweden and I'm originally from Italy, and the situation perhaps it's quite privileged compared to other countries where water, those effluent water are used for multiple purposes, even for recreational purposes. So the situation is quite different in different countries, and we need to take that into account. I'll close here. Thanks.
Thank you so much, Andrea. I think you raised a really important point about what's happening in the water, but not just for us in Europe, but also where production is taking place. As mentioned before, most of APIs are produced in India and China, where regulations are lower, and that impacts greatly the communities and their livelihoods, especially those living in the vicinity of production areas. So it's always important to also think about this side of the supply chain and how we can really solve problems, not just here, but elsewhere as well. Thank you all for these important points. I see some questions, so I'm gonna jump into questions. I would start with this one, maybe. What would be the main criteria that are that should be considered in sustainable procurement? If anyone wants to jump in, I know that Samira, Courtney, this could be of interest to you.
I mean, I think it ranges across by different countries' interests. So the Nordics' interests are very much in the water topic, wastewater pollution. They're really driving that home as a leader, I think, in this space. I think NHS England's really doubling down on carbon and greenhouse gas emissions. France is looking at product level carbon footprinting, and they're launching their first tender asking for that imminently, from what I understand. I think interestingly, Spain, from what I can hear, is looking at ISO standards and asking for conformance to different environmental ISO standards, and really looking at that as the route for information gathering. Yeah, so I think there, but it crosses what I would say is, you know, water, wastewater, carbon. I've seen now also some topics coming out of like Denmark, for example, looking at circularity. So some of the drug delivery devices, they're asking questions about, are you participating in take-back programs? What plastics are you using in your packaging? Scotland, NHS Scotland did a consultation on 30% of the plastics in your secondary and tertiary packaging coming from recycled plastics. They were going to make that a mandatory requirement, but have now just narrowed that to just get information gathering. So I think recycled plastics going into auxiliary products or packaging is an area of additional focus. So I think, I mean, that's just from my purview of what I'm hearing of requirements coming down from public procurement.
Yeah, that's interesting. I think also the just a reflection here is we're hearing a lot of the same countries being repeated, the Nordics, Spain, France. It's also food for thought on how this could be replicated in other EU countries that are still lagging behind a bit on meeting these criteria or even introducing them in public procurement. We know in some countries price is still the main factor. So yeah, just food for thought. Another, does anyone want to add something to Courtney's response? All good. Another question I think is a bit tricky, but I think, Andrea, it goes back to your point on knowledge and technology transfer. Having mentioned technology transfers, but given the EU's drive for tech sovereignty and their perspective of unfair Chinese competition, is there a way to potentially overcome this issue? I think, Andrea, Katerina, if you want to jump in here.
Very difficult question to answer, to be honest. I'll try to attempt this. Yeah, it's absolutely tricky. Tech transfer is never easy, especially with countries like China, where again there are some sort of barriers when it comes to sharing knowledge, technology, and all of that, and data as well. I think trying to have a more structured way of doing this technology transfer, by also at the same time keeping some strategic autonomy and fairness, in this case for the EU, could be the way forward. But I think it's far from being easy. If I need to compare, for example, to another situation somewhat related, so the pandemic treaty, perhaps most of you might be aware of that, but one of the points, so it was supposed to be agreed by several countries last year, and then it was postponed specifically on the point, one of the critical point was indeed the tech transfer and the IP transfer. So that's, I think, still a topic which is quite sensitive and doesn't really align with multiple countries. So it's definitely something that should be navigated carefully and yeah, keeping in mind the principle of fairness and more structured tech transfer. That would be my answer.
Thank you for responding to that. I know it was tricky, but I think you made a very nice point. I see someone has their hand up. Jennifer, would you like to ask your question? Go ahead.
Yes, hello. So my name is Jennifer. I work for Medicines for Europe, which represents the off-patent industry. And I just wanted to make a small comment to explain that Medicines for Europe actually supports the application of meat criteria, including environmental criteria. And we actually agreed with the points that were made about the importance of dialogue between procurement bodies and manufacturers to help establish well-informed and effective criteria that will encourage both to reduce environmental impact, but also to sustain a reliable access to affordable medicines. So it's really about striking this balance between the two things. Thank you.
Thank you, Jennifer, for this comment. Does anyone want to respond, or as we're waiting for more questions?
I think it's a good point around this, what we started with Samira and myself around security of supply and access versus, additional criteria that may help with the race to the bottom price challenge that we face right now. So I think it's well put, Jennifer.
Yeah, I just want also to make a last point maybe on this topic is that currently all public healthcare organizations face budget cuts, and this is a very, very, I mean, it's really problematic for even let's say procurement manager within their organization to push for more meat criteria, because it's seen as let's say putting the price up then down, and unfortunately savings and price are understood as, let's say, having a common relationship, which is again I mean, we know that it's not directly linked. We on a long-term run, we can't make savings only with a low price. I mean, low price have a cost, and we have also to measure that. So I just want us also to make this point linked to the fact that discussing with the market and with the industry help also buyers and procurement manager to get the right, let's say, level information to come back to their organization and to convince to go for meat criteria rather than price only criteria. So it's also a problem of budget cuts and how to deal with this and to let's say go out from this price only way of procuring.
Thank you, Samira. I think, yes, there are challenges with that. Also, countries that are more, as previously mentioned, lower to middle income countries may also have problems with that, incorporating sustainability criteria rather than price only. We always have the problem of budget cuts, I think, in the political atmosphere right now. That is always lingering. I'm thinking if there's more questions. I think we covered all of them. I would like to make some final reflections before ending the session. Thank you all for being here today, of course. I think we made some really interesting points from the first discussion block, thinking about how to make regulations more binding rather than relying solely on voluntary regulations and pledges. Also, we touched a lot on the consumer side. Katerina raised a nice point on how us as consumers can start with reducing our environmental pollution at home. And also, Andrea raised a nice point about engaging the community. I think to have actual sustainable change, we all should feel involved, especially that, healthcare medicine affects us. We are the patients at the end of the day as much as it affects the environment and the livelihoods of people and ecosystems and so on. We also touched in the next block on really nice points on standardization and sustainability metrics. Right now, it's quite fragmented. There are different criteria, which makes it harder for manufacturers to kind of compare. And data sharing also was brought up. I think this is very important. Knowledge transfer, not just for here, but along the supply chain on a more global level to India and China. As you mentioned, Courtney, we know where the hotspots are, so we should get into action. And I think the final point raised by Andrea as well on the varying hotspots, reshoring now is in discussion. I think it's a big topic in the EU. They want to bring back medicine production to Europe. So what questions that does have on our environment here in Europe? What kind of regulations do we have in place? These are all questions to be raised in the future when that takes place. And finally, your recommendations on more support to public buyers as they have, as Katerina put it, come later at this stage rather than private suppliers who, private buyers, sorry, who already have experience in purchasing and incorporating sustainability metrics. So thank you all also for sharing some tools and practical solutions, practical actions that can be taken, some tools that are already available. We work with what we already have, and we try as much as we can to push for more sustainable standards and tools. If you have any final reflections, you are also open, since we didn't receive more questions, you're also open to reflect before we end the webinar. I would also take a moment to say we have a post survey for people who attended. Please make sure you take that survey. We would like to understand what you got out of this session, whether what was helpful, what kind of information you're still interested in, so we can work on that accordingly. Well, with this, I will finish the session. Thank you all for being here. And this meeting is recorded, as you know, and will be shared afterwards. If you would like to revisit some of the points that were mentioned by our speakers, you can always go back to the recording and re-listen to that. I think a lot of interesting and thought-provoking discussions were made. So yeah, I know myself, I will be revisiting this recording. Thank you so much for being here, Courtney, Andrea, Samira, and Katerina. I will end today's session with
Thanks.
Thanks for having us.
Thank
Yeah.
you.
Take care.
Thank you for all for joining as well, and stay tuned for the recording.